And it's fitting that the opening statement for H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022, be delivered by one of Jackie's closest friends and now the acting Republican leader of Subcommittee on Worker and Family Support. I yield to Dr. Wenstrup.
Well, thank you, Mr. Chairman. Thank you, Mr. Brady. Thank you for bringing up the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022. I want to take a moment to reflect on what we're doing here today. This markup serves as an opportunity to celebrate and remember our dear colleague and friend, Jackie Walorski. She was my battle buddy, indeed my very dear friend. And I'm honored to be able to work to continue her work. And I want to recognize her husband, Dean, my friend, Dean, and her dear mother, Mert, our friend, Susan Brooks, our friend, Sharon, and really all of Jackie's staff, former staff that are here today. Dean, I may feel a need to send a text to Jackie during this, as you know. I'm proud to help lead our efforts here to reauthorize and grow evidence-based home visiting programs and help more moms and babies. I can't think of a better way to honor my friend Jackie Walorski than seeing this through. Today is an opportunity to recognize Jackie's legacy and what she supported, believed in, and advocated for. Improving outcomes for vulnerable families and children, which really was her life's work all along. As ranking member of the Worker and Family Support Subcommittee, Jackie made a tremendous amount of progress working with Representative Davis on this bill prior to her passing. The bill includes many of the areas she felt strongly about, including increasing transparency about outcomes for families and targeting dollars to the neediest communities. I'm glad we were able to find common ground with our colleagues to get this bill done, to provide stability for the program and the vulnerable families that it serves. As a physician, I'm very familiar with the evidence-based efforts of in-home support for both new parents and children, and I really value the program's focus on preventative health. Last month, I met with young moms in Ohio who went through the Nurse Family Partnership. I've seen firsthand how the program helps maternal and child health, family safety and stability, child development, and readiness for school. It's a broad range. To look at these people in the eyes and hear them tell me, quote, "I don't think my child would be healthy without this program. Home visiting made all the difference in the world for me and my now healthy child." To hear from a young mom, to know that she's in a better place and on a better path, reminded me of the good work that this program does and showed me the value of investing in a program that we know works. Our bipartisan legislation reauthorizes McV, as we call it, for 5 years and will serve moms and babies by growing the capacity of the program in partnership with states. First, by phasing in a state match to vulnerable populations, we will expand the reach of evidence-based home visiting programs across the country by adding $174 million in new state funding. Second, we target funds to families in poverty by directing 3/4 of additional McV funding based on the number of children under 5 in poverty in each state. Third, the bill improves outcomes reporting so more people will have visibility into the good work being done by home visitors. HHS will implement a state outcomes dashboard so we have more transparency on program performance measures and clinical indicators to show actual impact on families. Outcomes and transparency, two things that were very important to Jackie in her efforts. Lastly, we apply lessons learned from the pandemic and allow virtual visits to continue on a limited basis while maintaining McV's commitment to in-person visits and high evidence standards. So I'm proud to support this legislation, named in honor of my friend, Representative Jackie Walorski. Jackie was a devoted public servant who was a champion of this bill, of McV, and especially the Healthy Families Indiana program she visited within her district. I urge my colleagues to support this bill. I'm humbled to be Jackie's voice here today to help carry out her great works, and I yield back.